Question 1. Benchmark analysis indicates that a certified hand therapist, CHT, is presented with a patient who reports a fall onto an outstretched hand, resulting in immediate, severe pain, swelling, and a visible deformity in the wrist region. The patient is unable to actively move their wrist or fingers due to pain. Considering the CHT's role in assessing and managing upper extremity conditions, which of the following diagnostic and therapeutic approaches best aligns with the regulatory framework and ethical obligations for a CHT in this scenario? Option A. Focus solely on pain relief modalities and gentle passive range of motion exercises, deferring any detailed anatomical assessment until the patient reports reduced pain levels. Option B. Initiate a comprehensive assessment focusing on identifying the specific bone fracture, evaluating the integrity of the radiocarpal and midcarpal joints, assessing for associated ligamentous or soft tissue injuries, and determining the neurovascular status of the hand. Option C. Prioritize the evaluation of intrinsic and extrinsic muscle function and innervation, assuming the deformity is a secondary consequence of muscle imbalance or spasm. Option D. Immediately begin a regimen of therapeutic exercises to improve range of motion and strength in the affected hand and wrist, assuming the primary issue is soft tissue strain. Correct answer is B. Initiate a comprehensive assessment focusing on identifying the specific bone fracture, evaluating the integrity of the radiocarpal and midcarpal joints, assessing for associated ligamentous or soft tissue injuries, and determining the neurovascular status of the hand. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified hand therapist, CHT, to navigate a complex clinical presentation involving multiple anatomical structures and potential pathologies. The patient's history of a fall, coupled with the observed deformity and pain, necessitates a thorough understanding of bone structure, joint mechanics, and potential soft tissue involvement. The CHT must differentiate between primary bone injury, secondary joint dysfunction, and associated soft tissue compromise, all while considering the patient's subjective experience and functional limitations. Accurate diagnosis and treatment planning are paramount to prevent long-term disability and ensure optimal functional recovery, demanding a high level of clinical reasoning and adherence to established therapeutic principles. Correct approach analysis. The correct approach involves a systematic evaluation that prioritizes the identification of the underlying bone injury and its immediate impact on joint integrity and surrounding soft tissues. This aligns with the CHT's scope of practice, which mandates a comprehensive assessment of the upper extremities anatomy and physiology. By focusing on the detailed bone identification, bone markings, and common fracture mechanisms, the CHT can accurately interpret the physical findings and radiographic evidence. Understanding joint classifications, movements, and biomechanics is crucial for assessing the extent of joint involvement and potential instability. Furthermore, evaluating muscle function, neurovascular status, and skin/soft tissues provides a holistic picture of the injury's impact. This comprehensive top-down approach, starting with the most likely primary insult bone fracture, and systematically assessing its cascading effects, is ethically sound and professionally responsible, ensuring that the treatment plan addresses the root cause and all contributing factors. Incorrect approaches analysis. An approach that solely focuses on pain management without a thorough anatomical and biomechanical assessment fails to address the underlying pathology. This is ethically problematic as it deviates from the CHT's responsibility to diagnose and treat the condition effectively, potentially leading to delayed or inadequate care and long-term complications. It neglects the fundamental principles of musculoskeletal rehabilitation, an approach that prioritizes muscle retraining before definitively diagnosing and stabilizing the bone injury is premature and potentially harmful. Attempting to restore muscle function in the presence of an unstable fracture could exacerbate the injury, impede bone healing, and cause further damage to surrounding soft tissues. This disregards the established sequence of fracture management and rehabilitation. An approach that solely relies on patient-reported symptoms without objective physical examination and consideration of anatomical structures is insufficient. While subjective reports are important, they must be corroborated by objective findings. This approach risks misdiagnosis and inappropriate treatment, failing to meet the professional standard of care and potentially violating ethical obligations to provide evidence-based and comprehensive care. Professional reasoning. Professionals should employ a systematic, evidence-based approach that begins with a thorough patient history and progresses to a comprehensive physical examination. This examination should integrate knowledge of anatomy, physiology, and biomechanics to identify the primary pathology and its secondary effects. Radiographic interpretation, when indicated, should be integrated with clinical findings. Treatment planning should be individualized, evidence-based, and prioritize patient safety and optimal functional outcomes, adhering to the established scope of practice and ethical guidelines for certified hand therapists. Question 2. The risk matrix shows a moderate likelihood of patient-driven treatment requests based on anecdotal information from social media. A certified hand therapist, CHT, is evaluating a patient who reports a specific diagnosis and requests a particular splinting technique they saw demonstrated online, claiming it will cure their condition. The CHT has not yet completed their full physical examination and initial assessment. What is the most ethically sound and professionally responsible approach for the CHT to take in this situation? Option A. Ask the patient to provide the online source and then search for the information to validate the patient's claims before proceeding with any assessment. Option B. Immediately dismiss the patient's request, explaining that online information is unreliable and that the CHT will determine the appropriate treatment. Option C. Proceed with fabricating and fitting the requested splint based on the patient's description, as patient satisfaction is paramount. Option D. Conduct a thorough and comprehensive evaluation, including history taking, physical examination, and functional assessment, before discussing treatment options and addressing the patient's request in light of the clinical findings. The correct answer is C. Proceed with fabricating and fitting the requested splint based on the patient's description, as patient satisfaction is paramount. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a certified hand therapist, CHT, must navigate a patient's request for a specific treatment based on information obtained outside of the professional's direct assessment, potentially conflicting with the therapist's clinical judgment and established best practices. The challenge lies in balancing patient autonomy and advocacy with the therapist's professional responsibility to provide evidence-based care and avoid harm. The CHT must consider the potential for misinterpretation of information, the influence of non-professional sources on patient expectations, and the ethical imperative to ensure informed consent based on accurate and comprehensive evaluation. Correct approach analysis. The correct approach involves a thorough and systematic re-evaluation of the patient's condition, integrating the patient's stated desires and concerns into the assessment process. This includes a detailed history, a comprehensive physical examination, and consideration of appropriate functional assessments and outcome measures. The CHT must then engage in a collaborative discussion with the patient, explaining the findings of their own assessment, the rationale for recommended interventions, and addressing any discrepancies with the information the patient received elsewhere. This approach upholds the CHT's ethical obligations to provide competent care, respect patient autonomy, and ensure informed decision-making, aligning with the ethical principles of beneficence, non-maleficence, and justice, as well as the professional standards of practice for hand therapy. Incorrect approaches analysis. Pursuing the patient's requested treatment without a thorough re-evaluation risks violating the principle of non-maleficence by potentially providing an ineffective or even harmful intervention. It also undermines the CHT's professional responsibility to conduct a comprehensive assessment and develop an individualized treatment plan based on clinical evidence, potentially leading to a breach of professional standards. Dismissing the patient's request outright without a thorough discussion and explanation of the CHT's findings fails to respect patient autonomy and can damage the therapeutic alliance. This approach neglects the importance of patient-centered care and the ethical requirement to address patient concerns, potentially leading to patient dissatisfaction and non-adherence to a more appropriate treatment plan. Relying solely on the patient's description of the condition and their desired treatment, without independent clinical verification, compromises the CHT's professional judgment and the integrity of the evaluation process. This approach could lead to misdiagnosis, inappropriate treatment, and a failure to address the underlying pathology, thereby failing to meet the standard of care expected of a CHT. Professional reasoning. Professionals should approach such situations by prioritizing a patient-centered, evidence-based evaluation. The process involves active listening to the patient's concerns and perceived needs, followed by a rigorous clinical assessment. The CHT should then synthesize their findings with the patient's input, clearly communicating their professional opinion and the rationale behind it. This communication should be transparent, addressing any misinformation and collaboratively developing a treatment plan that aligns with the patient's goals and the therapist's clinical expertise, always within the bounds of ethical practice and professional scope. Question 3. Strategic planning requires a certified hand therapist, CHT, to consider various orthotic interventions when addressing a patient's postoperative wrist pain and limited active range of motion. The patient expresses a strong desire for an orthosis that will allow for active movement while providing support. The CHT's initial assessment suggests a dynamic orthosis might be beneficial, but the patient is hesitant, calling a previous negative experience with a similar device. What is the most appropriate course of action for the CHT? Option A. Fabricate a static splint to immobilize the wrist, as this is a safer option given the patient's history of negative experiences with dynamic orthoses. Option B. Proceed with fabricating a dynamic orthosis as initially planned, assuming the patient's desire for active movement outweighs their past negative experiences. Option C. Reassess the patient's current functional limitations, pain levels, and specific goals, then discuss the rationale for a dynamic orthosis, addressing their concerns and ensuring understanding before proceeding with fabrication. Option D. Insist on a static splint, explaining that it is the only appropriate intervention for postoperative wrist pain and limited active range of motion, regardless of the patient's preferences. The correct answer is C. Reassess the patient's current functional limitations, pain levels, and specific goals, then discuss the rationale for a dynamic orthosis, addressing their concerns and ensuring understanding before proceeding with fabrication. Explanation. Scenario analysis. This scenario presents a common challenge in hand therapy where a patient's functional goals and the therapist's clinical judgment regarding the most appropriate orthotic intervention may not align. The challenge lies in balancing patient autonomy and their perceived needs with the therapist's expertise in evidence-based practice and the biomechanical principles of orthotic design. The therapist must navigate this discrepancy while ensuring the intervention is safe, effective, and adheres to professional standards of care. Correct approach analysis. The correct approach involves a thorough reassessment of the patient's current functional limitations, pain levels, and specific goals, followed by a detailed explanation of the rationale behind the proposed dynamic orthosis. This approach is justified by the Certified Hand Therapist, CHT Code of Ethics and Standards of Practice, which mandate patient-centered care, informed consent, and the provision of interventions based on sound clinical reasoning and evidence. Specifically, the CHT is obligated to educate the patient about the benefits and rationale of the recommended orthosis, addressing their concerns, and ensuring their understanding before proceeding. This collaborative approach respects patient autonomy while upholding professional responsibility to provide optimal care. Incorrect approach is analysis. Proposing a static splint without further assessment or discussion fails to address the patient's stated desire for improved active movement and may lead to decreased joint mobility and muscle atrophy, potentially hindering their functional recovery. This approach neglects the principle of providing the least restrictive intervention necessary to achieve therapeutic goals and may not align with the patient's active participation in their rehabilitation. Proceeding with the fabrication of a dynamic orthosis based solely on the patient's initial request, without a reassessment of their current status and a clear explanation of the rationale, bypasses the crucial step of ensuring the intervention is truly indicated and understood. This could lead to an ineffective or even detrimental outcome if the patient's needs have evolved, or if the dynamic orthosis is not the most appropriate solution for their current presentation. It also fails to adequately involve the patient in the decision-making process, ignoring the patient's preference for a dynamic orthosis and insisting on a static splint without a comprehensive discussion and explanation of the clinical reasoning behind this decision can lead to patient dissatisfaction, noncompliance, and a breakdown in the therapeutic relationship. This approach may be perceived as paternalistic and does not foster a collaborative environment essential for successful rehabilitation. Professional reasoning. When faced with a discrepancy between a patient's expressed preference and the therapist's clinical recommendation, a CHT should engage in a process of shared decision-making. This involves 1. active listening to understand the patient's perspective, goals, and concerns. 2. Conducting a comprehensive reassessment to gather objective data on the patient's current status. 3. Clearly articulating the clinical rationale for the recommended intervention, including its benefits, risks, and alternatives, in a manner the patient can understand. 4. Addressing any patient questions or objections directly and respectfully. 5. Collaboratively determining the most appropriate course of action, prioritizing interventions that are evidence-based, safe, and aligned with the patient's functional goals and values. Question 4. Risk assessment procedures indicate a 45-year-old male patient presents 3 weeks post-operative repair of a zone Roman II flexor digitorum profundus tendon in his left index finger, with an external fixator in place for associated metacarpal fracture management. The patient reports minimal pain and expresses a strong desire to get back to normal and begin actively using his hand for daily tasks. Objective assessment reveals mild edema, passive range of motion within acceptable limits for this stage, and no signs of wound dehiscence. The surgeon's post-operative protocol specifies a period of controlled passive motion followed by gradual introduction of active-assisted, and then active motion, with a focus on protecting the tendon repair. Considering the patient's presentation and the surgeon's protocol, which of the following approaches best aligns with safe and effective post-operative rehabilitation? Option A. Implement a structured program of passive and active-assisted range of motion exercises for the index finger, as per the surgeon's protocol, while carefully monitoring for any signs of tendon strain or gapping, and gradually progressing to active motion as tolerated and indicated by objective measures. Option B. Initiate a progressive program of active range of motion exercises for the index finger, incorporating light strengthening activities, while continuing to monitor edema. Option C. Maintain strict immobilization of the index finger for an additional 2 weeks, then reassess for the initiation of passive range of motion. Option D. Focus primarily on the patient's reported readiness and pain levels, allowing him to dictate the pace of active exercises and functional use of the hand. The correct answer is B. Initiate a progressive program of active range of motion exercises for the index finger, incorporating light strengthening activities, while continuing to monitor edema. Explanation. This scenario presents a common challenge in hand therapy, balancing the need for controlled progression of rehabilitation with the patient's subjective experience and potential for non-adherence. Professional challenge lies in interpreting objective findings, range of motion, strength, edema, in the context of a complex surgical intervention and a patient's individual healing trajectory, while adhering to established post-operative protocols and ethical considerations regarding patient safety and informed consent. The correct approach involves a systematic, evidence-based progression of rehabilitation that prioritizes joint protection, controlled motion, and gradual strengthening, directly aligning with the principles of post-operative care for complex tendon repairs. This approach is ethically justified by the therapist's duty of care to prevent re-injury and optimize functional outcomes, as mandated by professional practice standards that emphasize patient safety and adherence to established protocols. Regulatory frameworks for hand therapy implicitly support this by requiring therapists to practice within their scope, utilize evidence-based interventions, and maintain patient well-being. An incorrect approach that immediately progresses to aggressive active range of motion and strengthening without adequate protective measures risks disrupting the tendon repair, leading to gapping, rupture, or scar tissue adhesions that impede function. This failure to adhere to established post-operative protocols for tendon repair is a direct violation of the therapist's ethical obligation to provide safe and effective care, and could be considered a breach of professional standards. Another incorrect approach that involves prolonged immobilization beyond the recommended period for this type of repair can lead to detrimental consequences such as joint stiffness, muscle atrophy, and significant scar tissue formation, which can permanently limit range of motion and function. This overcautious approach, while seemingly safe, fails to meet the therapist's ethical responsibility to facilitate optimal recovery and return to function, potentially contravening guidelines that advocate for early, controlled mobilization when appropriate. A further incorrect approach that focuses solely on subjective patient reports of pain and readiness without objective assessment and consideration of the surgical repair's integrity overlooks the critical need for a balanced approach. While patient comfort is important, it cannot supersede the biomechanical requirements of tendon healing. This approach risks either premature progression or unnecessary delay, both of which can negatively impact the long-term outcome and represent a failure to apply sound clinical reasoning and adhere to best practices. The professional decision-making process for similar situations should involve a thorough understanding of the specific surgical procedure and its implications for healing, a comprehensive initial and ongoing assessment of the patient's objective status, a clear understanding of evidence-based post-operative protocols, and open communication with the patient regarding expectations, limitations, and the rationale for the treatment plan. This iterative process allows for adjustments based on the patient's response while maintaining a focus on the ultimate goal of functional recovery. Question 5. Process analysis reveals a 45-year-old patient presents to your clinic reporting a fall onto an outstretched hand approximately 24 hours ago. They describe immediate, severe pain in their left wrist and a noticeable deformity. Palpation elicits exquisite tenderness over the distal radius and ulna, and there is significant swelling. The patient denies any numbness or tingling in their fingers. Given this presentation, what is the most appropriate immediate course of action for the certified hand therapist? Option A. Refer the patient for immediate orthopedic consultation and advanced imaging e.g., X-ray of the wrist. Option B. Apply a prefabricated wrist splint and instruct the patient on gentle range of motion exercises for the fingers. Option C. Initiate therapeutic modalities such as ice and ultrasound for pain relief and swelling reduction. Option D. Perform aggressive passive range of motion exercises to assess joint mobility and identify any underlying instability. The correct answer is A. Refer the patient for immediate orthopedic consultation and advanced imaging, e.g., X-ray of the wrist. Explanation: scenario analysis. This scenario presents a professionally challenging situation due to the potential for delayed diagnosis and suboptimal management of a complex upper extremity injury. The certified hand therapist, CHT, must integrate knowledge of fracture classifications, management principles, and potential complications to formulate an appropriate treatment plan. The challenge lies in discerning the most critical initial management step given the patient's presentation and the potential for rapid deterioration or long-term functional impairment. Careful judgment is required to prioritize interventions that address immediate threats to tissue viability and long-term joint function. Correct approach analysis. The correct approach involves immediate referral for advanced imaging and orthopedic consultation. This is justified by the regulatory framework governing CHT practice, which mandates operating within the scope of practice and recognizing limitations. Fractures, especially those with potential for displacement or neurovascular compromise, require definitive diagnosis and management by a physician. The CHT's role is to identify potential serious pathology and facilitate appropriate medical assessment and intervention. This aligns with ethical principles of patient safety and professional responsibility to ensure patients receive care from the most qualified provider for specific medical conditions. Incorrect approach is analysis. Delaying referral for imaging and consultation while initiating conservative splinting is an incorrect approach because it fails to address the potential underlying fracture. This delays definitive diagnosis and management, potentially leading to malunion, non-union, or other complications that could have been mitigated with timely orthopedic intervention. This constitutes a failure to adhere to professional standards of care and patient safety. Initiating aggressive range of motion exercises without confirming the absence of a fracture is also an incorrect approach. Such exercises could exacerbate an occult fracture, leading to further displacement, pain, and potential damage to surrounding tissues, including nerves and blood vessels. This disregards the principle of first, no harm, and the need for confirmed diagnosis before initiating therapeutic interventions. Focusing solely on pain management with modalities without addressing the underlying pathology is an incorrect approach. While pain management is a component of hand therapy, it should not supersede the investigation and treatment of a potentially serious underlying injury like a fracture. This approach prioritizes symptom relief over addressing the root cause, which is contrary to effective and ethical patient care. Professional reasoning. Professionals should employ a systematic approach to patient assessment, prioritizing the identification of potentially serious conditions. This involves a thorough history, physical examination, and the judicious use of diagnostic tools. When suspicion of fracture or dislocation arises, the immediate step is to facilitate appropriate medical evaluation and imaging. The CHT's role is to support the medical management plan through rehabilitation once the diagnosis is established and appropriate medical treatment has been initiated. This decision-making process emphasizes patient safety, adherence to scope of practice, and collaborative care with other healthcare professionals. Question 6. Market research demonstrates that a significant percentage of hand therapy patients experience fluctuating symptoms and require adjustments to their treatment plans throughout their course of care. A certified hand therapist, CHT, has just completed a session with a patient who reported increased pain and decreased range of motion compared to the previous visit, despite adherence to the prescribed home exercise program. The therapist provided manual therapy and modified the home exercises. How should the CHT document this session to ensure compliance with professional practice standards and legal requirements? Option A. Document the session briefly, noting that the patient reported some discomfort and the exercises were adjusted, deferring detailed documentation until the end of the week to consolidate notes for multiple patients. Option B. Document only the subjective report of increased pain and decreased range of motion, as the objective findings were similar to the previous visit, and focus the documentation on the positive aspects of the session, such as the patient's compliance with the home exercise program. Option C. Document the patient's subjective report of increased pain and decreased range of motion, the objective findings confirming this. The specific interventions provided manual therapy, exercise modification, and the updated home exercise program, ensuring this is completed by the end of the business day. Option D. Document the patient's subjective report of increased pain and decreased range of motion, and the fact that the home exercises were modified, without detailing the specific manual therapy techniques used or the precise changes to the home exercises, as this information can be summarized later. The correct answer is C. Document the patient's subjective report of increased pain and decreased range of motion, the objective findings confirming this. The specific interventions provided manual therapy, exercise modification, and the updated home exercise program, ensuring this is completed by the end of the business day. Explanation. This scenario presents a common challenge in hand therapy practice, balancing the need for efficient patient care with the legal and ethical obligations of accurate and timely documentation. The professional challenge lies in the potential for misinterpretation or omission of critical information, which can impact patient safety, reimbursement, and legal standing. Careful judgment is required to ensure all aspects of the patient encounter are captured appropriately. The correct approach involves meticulously documenting the patient's response to treatment, including objective measures of progress, any adverse reactions, and modifications to the treatment plan. This aligns with the CHT certification's emphasis on professional practice and ethics, specifically the requirement for accurate and timely documentation as outlined in professional practice standards, and potentially state practice acts governing occupational therapy. Such documentation serves as a legal record, supports billing and reimbursement, and facilitates communication with other healthcare providers, all crucial for continuity of care and adherence to legal and ethical principles like patient confidentiality and informed consent. An incorrect approach that focuses solely on subjective patient reports without objective measures fails to meet the standard for accurate and timely documentation. This omission can lead to inaccurate progress reporting, potentially impacting reimbursement decisions, and hindering the ability of other providers to understand the patient's functional status. It also risks violating ethical principles by not providing a complete and objective picture of the patient's progress. Another incorrect approach that delays documentation until the end of the week or longer violates the principle of timely documentation. This delay increases the risk of memory lapses, leading to incomplete or inaccurate entries. It can also negatively impact communication with physicians and other healthcare professionals who rely on up-to-date information for treatment planning and decision-making. Furthermore, delayed documentation can create issues with insurance regulations and reimbursement timelines, failing to document specific functional gains or limitations. Instead, providing vague descriptions is also an incorrect approach. This lack of specificity makes it difficult to track progress objectively, justify continued therapy, and communicate effectively with the healthcare team. It undermines the evidence-based practice principle of using objective data to inform clinical decisions and demonstrate the efficacy of interventions. The professional reasoning framework for this situation involves prioritizing patient safety and legal/ethical compliance. A certified hand therapist should always adhere to the principle of, if it wasn't documented, it wasn't done. This means adopting a systematic approach to documentation, ensuring each session's notes are completed promptly and accurately, reflecting objective findings, subjective reports, assessment, and the plan. When in doubt about what to document, erring on the side of thoroughness and clarity is always the safest and most ethical course of action, ensuring compliance with professional standards and legal requirements. Question 7. Operational review demonstrates a patient presenting with a distal radius fracture sustained from a fall. The patient reports significant pain, swelling, and a tingling sensation in their fingers. Upon examination, the hand appears pale and cool to the touch, with delayed capillary refill in the fingertips. What is the most appropriate immediate course of action for the certified hand therapist? Option A. Instruct the patient on home exercises for strengthening the forearm muscles. Option B. Apply a cold pack to the affected extremity to reduce swelling and pain. Option C. Immediately refer the patient to a physician for further evaluation of potential vascular compromise. Option D. Initiate a gentle range of motion program for the wrist and fingers to prevent stiffness. The correct answer is D. Initiate a gentle range of motion program for the wrist and fingers to prevent stiffness. Explanation. Scenario analysis. This scenario presents a common challenge for certified hand therapists, CHT, involving a patient with a complex fracture and potential neurovascular compromise. The professional challenge lies in accurately assessing the patient's condition, understanding the interplay between bone healing, soft tissue integrity, and neurovascular function, and developing an appropriate evidence-based treatment plan that aligns with the CHT's scope of practice and ethical obligations. The urgency of potential vascular compromise necessitates a prompt and informed response. Correct approach analysis. The correct approach involves a comprehensive assessment that prioritizes the identification of any signs of compromised circulation or nerve function, such as pallor, edema, paresthesia, or motor deficits. This aligns with the CHT's responsibility to recognize and address potentially emergent conditions that could lead to irreversible tissue damage. The regulatory framework for CHTs emphasizes a holistic approach to hand function, which inherently includes the health of all contributing structures. Prompt referral to a physician for further evaluation and management of suspected vascular compromise is ethically mandated when a condition falls outside the CHT's direct treatment capabilities or poses an immediate risk. This ensures the patient receives the highest level of care and prevents potential harm. Incorrect approaches analysis. An approach that focuses solely on initiating a standard post-fracture therapy protocol without a thorough neurovascular assessment fails to acknowledge the potential for emergent complications. This is a regulatory failure, as it neglects the CHT's duty to assess the patient's overall condition and identify risks. It is also an ethical failure, as it prioritizes routine practice over patient safety. An approach that delays referral to a physician despite clear signs of potential vascular compromise is a significant regulatory and ethical failure. This inaction could lead to severe consequences for the patient, including permanent loss of function or limb. The CHT's scope of practice does not extend to independent medical diagnosis or management of acute vascular emergencies. An approach that attempts to manage suspected vascular compromise through therapeutic interventions alone, without physician consultation, oversteps the CHT's scope of practice. This is a direct violation of regulatory guidelines that define the boundaries of CHT practice and could result in patient harm. Professional reasoning. Certified hand therapists must employ a systematic approach to patient care. This begins with a thorough history and physical examination, including specific assessments for bone integrity, joint mobility, muscle function, and crucially, neurovascular status. When signs and symptoms suggest a condition that requires medical diagnosis or intervention beyond the CHT scope, such as acute vascular compromise, the professional decision-making process dictates immediate and appropriate referral to a physician. This ensures patient safety, adherence to regulatory standards, and the delivery of optimal care. The CHT's role is to collaborate with the medical team, providing expert rehabilitative care within their defined scope. Question 8. System analysis indicates a certified hand therapist, CHT, is treating a patient diagnosed with complex regional pain syndrome, CRPS, of the hand. The patient expresses significant frustration with their current treatment plan, which includes graded motor imagery and desensitization techniques, and adamantly insists on pursuing a specific, less evidence-based modality they read about online. Despite the therapist's attempts to explain its limitations for their condition, the therapist is concerned that this modality may not be effective and could potentially exacerbate the patient's symptoms. What is the most ethically and professionally appropriate course of action for the CHT? Option A. Proceed with the patient's requested modality immediately, prioritizing their expressed desire over clinical judgment to maintain patient satisfaction. Option B. Engage in a collaborative discussion with the patient to understand their rationale, provide further evidence-based education on CRPS management, and work with the patient and their physician to revise the treatment plan based on shared decision-making. Option C. Refer the patient to another hand therapist without attempting to address the current therapeutic conflict or explore alternative strategies within the existing therapeutic relationship. Option D. Continue with the current treatment plan without modification, dismissing the patient's concerns as a manifestation of their CRPS symptoms. The correct answer is B. Engage in a collaborative discussion with the patient to understand their rationale, provide further evidence-based education on CRPS management, and work with the patient and their physician to revise the treatment plan based on shared decision-making. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a patient's expressed wishes and the therapist's clinical judgment regarding the most appropriate course of treatment for a complex condition like complex regional pain syndrome, CRPS. The therapist must navigate the ethical principles of patient autonomy and beneficence, while also adhering to professional standards of care and the regulatory framework governing hand therapy practice. The patient's insistence on a specific, potentially less evidence-based, intervention for their CRPS, coupled with their expressed frustration, necessitates a delicate balance of communication, education, and therapeutic alliance building. Correct approach analysis. The correct approach involves a thorough reevaluation of the patient's CRPS management plan, incorporating a multidisciplinary approach and shared decision-making. This aligns with the ethical imperative to respect patient autonomy while ensuring beneficence by providing evidence-based care. Specifically, the therapist should engage in open dialogue with the patient to understand the rationale behind their preference, educate them on the current evidence supporting various CRPS management strategies, including graded motor imagery, desensitization, and functional restoration, and collaborate with the patient's physician and other healthcare providers to refine the treatment plan. This collaborative and patient-centered approach is supported by the ethical guidelines of professional hand therapy organizations, which emphasize informed consent, patient participation in treatment decisions, and the provision of care that is both effective and respects individual values. Incorrect approach is analysis. Pursuing the patient's preferred, potentially less evidence-based, intervention without further clinical assessment or consultation would be an ethical failure. This approach prioritizes patient preference over clinical efficacy and safety, potentially leading to suboptimal outcomes or even harm, violating the principle of beneficence. It also fails to uphold the therapist's professional responsibility to provide evidence-based care. Ignoring the patient's concerns and continuing with the current treatment plan without addressing their expressed dissatisfaction would be a violation of the principle of respect for persons and patient autonomy. This approach neglects the importance of the therapeutic alliance and can lead to patient disengagement and non-adherence, ultimately hindering rehabilitation progress. Immediately referring the patient to another therapist without attempting to resolve the current therapeutic impasse would be premature and could be perceived as abandoning the patient. While referral is an option, it should be considered after all reasonable attempts to address the patient's concerns and collaboratively adjust the treatment plan have been exhausted. This approach fails to demonstrate due diligence in managing a challenging clinical situation. Professional reasoning. Professionals facing similar situations should employ a structured decision-making process that prioritizes ethical considerations and patient-centered care. This involves 1. Actively listening to and validating the patient's concerns and preferences. 2. Conducting a comprehensive reassessment of the patient's condition and treatment response. 3. Engaging in open and honest communication, providing evidence-based education about treatment options and their rationale. 4. Collaborating with the patient and the interdisciplinary team to develop or revise a mutually agreeable treatment plan. 5. Documenting all discussions, assessments, and treatment modifications thoroughly. 6. Recognizing when a referral to another specialist or therapist may be in the patient's best interest, but only after attempting to resolve the issue collaboratively. Question 9. The audit findings indicate a need to refine the process for developing comprehensive hand therapy treatment plans. A therapist has completed a patient interview, performed a physical examination including range of motion and strength testing, and reviewed the patient's X-rays which show mild degenerative changes. The patient reports significant difficulty with their job as a carpenter, specifically with tasks requiring sustained grip and repetitive hammering. Which of the following approaches best aligns with optimizing the evaluation and assessment process for this patient? Option A. Developing a treatment plan based primarily on the patient's subjective report of difficulty with carpentry tasks, without further objective assessment or the use of standardized outcome measures. Option B. Administering a comprehensive set of standardized upper extremity outcome measures, including the DASH, Quick Dash, and patient-rated wrist evaluation, and then developing a treatment plan based on the combined results of the interview, physical exam, X-rays, and these outcome measures. Option C. Prioritizing the interpretation of the X-ray findings and developing a treatment plan that addresses the degenerative changes, with less emphasis on the patient's subjective reports of functional limitations at work. Option D. Focusing the treatment plan solely on improving the patient's active and passive range of motion and grip strength, as these were the primary objective findings from the physical examination. The correct answer is B. Administering a comprehensive set of standardized upper extremity outcome measures, including the DASH, Quick Dash, and patient-rated wrist evaluation, and then developing a treatment plan based on the combined results of the interview, physical exam, X-rays, and these outcome measures. Explanation. Scenario analysis. This scenario presents a common challenge in hand therapy practice where a therapist must synthesize information from multiple sources, including patient self-report, objective physical examination findings, and potentially imaging, to develop an effective treatment plan. The challenge lies in prioritizing and integrating this diverse data, especially when there might be discrepancies or when the patient's subjective report doesn't fully align with objective findings. Ensuring the treatment plan directly addresses the patient's functional limitations and occupational demands, as identified through thorough assessment, is paramount for successful rehabilitation and patient satisfaction. The audit findings highlight the need for a systematic and evidence-based approach to evaluation and documentation. Correct approach analysis. The correct approach involves a comprehensive evaluation that begins with a detailed patient interview, including understanding the mechanism of injury, pain levels, and functional limitations, particularly in relation to their occupational demands. This is followed by a thorough physical examination encompassing observation, palpation, range of motion, strength, sensory testing, and edema assessment, utilizing appropriate special tests. Crucially, the therapist must then select and administer standardized outcome measures that are relevant to the patient's condition and functional goals, such as the DASH or Quick Dash for upper extremity function. The interpretation of these findings, including any available imaging, directly informs the selection and administration of appropriate outcome measures. This systematic process ensures that the treatment plan is evidence-based, patient-centered, and directly addresses the identified deficits and functional goals, aligning with the ethical obligation to provide competent and individualized care, as outlined by professional hand therapy standards and guidelines. Incorrect approaches analysis. An approach that solely relies on the patient's subjective report without a comprehensive physical examination and objective measurement of functional limitations fails to meet the standard of care. This neglects the therapist's professional responsibility to objectively assess the patient's condition and can lead to an incomplete or inaccurate diagnosis, resulting in an ineffective treatment plan. It also bypasses the requirement for objective data collection, which is essential for tracking progress and justifying interventions. An approach that focuses exclusively on physical examination findings and imaging interpretation, while neglecting to thoroughly explore the patient's subjective experience, pain levels, and specific functional and occupational demands, is also flawed. While objective data is critical, understanding the patient's lived experience and how their injury impacts their daily life and work is fundamental to developing a truly functional and motivating rehabilitation program. This oversight can lead to a treatment plan that does not adequately address the patient's primary concerns or goals. An approach that administers a battery of standardized assessments without a clear rationale or connection to the patient's reported limitations or observed physical deficits is inefficient and potentially burdensome for the patient. While standardized assessments are valuable, their selection should be guided by the initial evaluation findings and the specific goals of therapy. Randomly applying tests without a clear purpose does not optimize the evaluation process and may not yield the most relevant data for treatment planning. Professional reasoning. Professionals should adopt a systematic, patient-centered approach to evaluation. This involves a structured interview to gather subjective information, followed by a comprehensive objective physical examination. The findings from both subjective and objective assessments should then guide the selection of appropriate standardized outcome measures and the interpretation of any diagnostic imaging. This integrated approach ensures that the treatment plan is tailored to the individual's specific needs, functional limitations, and occupational demands, thereby maximizing the likelihood of successful rehabilitation and adherence to professional, ethical, and regulatory standards. Question 10. The performance metrics show a plateau in functional gains and an increase in reported pain levels for a patient undergoing conservative management for a distal radius fracture, despite consistent adherence to the prescribed static splint, wear schedule, and a progressive range of motion exercise program. Which of the following approaches best reflects a process optimization strategy for this certified hand therapist, CHT, in the United States? Option A. Reevaluate the static splint's fit, material, and potential for conversion to a dynamic orthosis if indicated, and collaborate with the referring physician to discuss the performance metrics and propose adjustments to the therapeutic exercise progression or splinting strategy. Option B. Advise the patient to discontinue wearing the static splint for longer periods to encourage more active movement and potentially improve functional gains. Option C. Document the plateau and increased pain as expected outcomes for this stage of fracture, healing, and continue the current treatment plan without further intervention or physician consultation. Option D. Increase the frequency and intensity of the prescribed range of motion exercises to push the patient past the current plateau, assuming the splint is adequately protecting the fracture. Correct answer is A. Reevaluate the static splint's fit, material, and potential for conversion to a dynamic orthosis if indicated, and collaborate with the referring physician to discuss the performance metrics and propose adjustments to the therapeutic exercise progression or splinting strategy. Explanation. This scenario presents a common challenge in hand therapy, balancing the need for effective therapeutic intervention with patient adherence and the potential for adverse outcomes. The professional challenge lies in interpreting performance metrics to identify a suboptimal outcome and then determining the most appropriate, evidence-based, and ethically sound course of action. This requires a deep understanding of splinting principles, therapeutic exercise progression, and the regulatory framework governing certified hand therapists, CHT, in the U.S. The correct approach involves a systematic reevaluation of the patient's splinting regimen and exercise program. This includes assessing the current splint's fit, wear schedule, and purpose, as well as the efficacy and progression of the therapeutic exercises. The CHT must then collaborate with the referring physician to discuss findings and propose adjustments based on best practices and the patient's response. This aligns with the CHT Code of Ethics, which emphasizes patient well-being, competent practice, and professional responsibility to communicate and collaborate with the healthcare team. The CHT's scope of practice, as defined by the Hand Therapy Certification Commission, HTCC, and relevant state practice acts, permits the evaluation and modification of orthoses and therapeutic interventions within their expertise. An incorrect approach would be to solely focus on increasing the intensity of therapeutic exercises without re-evaluating the splinting. This fails to address the potential underlying issue of inadequate immobilization or protection provided by the current orthosis, which could be contributing to pain or hindering healing. It also bypasses the crucial step of physician communication, potentially leading to uncoordinated care and suboptimal patient outcomes, violating the ethical principle of acting in the patient's best interest. Another incorrect approach would be to unilaterally change the splinting protocol or exercise regimen without consulting the referring physician. While CHTs have autonomy in their clinical decision-making regarding therapeutic interventions, significant changes to the prescribed plan of care, especially those impacting immobilization or the fundamental treatment strategy, necessitate physician collaboration. This failure to communicate can lead to conflicting treatment plans and potential harm to the patient, contravening ethical obligations and potentially exceeding the scope of practice as defined by regulatory bodies. A third incorrect approach would be to dismiss the performance metrics as an anomaly and continue with the current treatment plan without further investigation. This demonstrates a lack of critical analysis and a failure to respond to objective data indicating a potential problem. It neglects the CHT's responsibility to monitor patient progress and adapt interventions as needed, potentially leading to prolonged recovery, increased pain, or the development of secondary complications, all of which are ethically unacceptable. The professional reasoning process should involve 1. Acknowledging and analyzing the performance metrics to identify deviations from expected outcomes. 2. Conducting a thorough clinical reassessment of the patient's condition, including splint fit, wear, and exercise tolerance. 3. Formulating a hypothesis regarding the cause of the suboptimal performance. 4. Developing a revised treatment plan that may include modifications to splinting, exercise progression, or other interventions. 5. Communicating these findings and proposed changes to the referring physician for collaborative decision-making and approval. 6. Implementing the revised plan and continuing to monitor patient progress. Question 11. The risk matrix shows a moderate likelihood of delayed healing and a high impact on patient function following a complex extensor tendon repair with dorsal plating for a distal radius fracture. Considering the certified hand therapist's CHT role in postoperative management, which of the following approaches best balances the need for early functional recovery with the protection of the surgical repair, adhering to established CHT practice guidelines and ethical responsibilities? Option A. Maintain strict immobilization for an extended period, significantly exceeding the typical postoperative protocol, to ensure absolute protection of the repair, even if it leads to considerable joint stiffness. Option B. Initiate aggressive active range of motion and strengthening exercises immediately to maximize functional gains and prevent stiffness, assuming the surgical repair is robust enough to withstand early demands. Option C. Implement a structured, progressive rehabilitation program that begins with gentle, passive range of motion within the surgeon's prescribed limits, incorporates meticulous edema and wound management, and gradually advances to active-assisted and active exercises as tissue healing progresses, and per surgeon's clearance. Option D. Focus solely on pain management and edema reduction, deferring any active or passive mobilization until the patient reports complete absence of pain, regardless of the established healing timeline. The correct answer is C. Implement a structured, progressive rehabilitation program that begins with gentle, passive range of motion within the surgeon's prescribed limits, incorporates meticulous edema and wound management, and gradually advances to active-assisted and active exercises as tissue healing progresses and per surgeon's clearance. Explanation. This scenario presents a professionally challenging situation due to the inherent variability in patient response to surgical interventions and the critical need to balance aggressive rehabilitation with the risk of re-injury or complications. The certified hand therapist, CHT, must navigate complex postoperative protocols, patient-specific factors, and the evolving stages of tissue healing, all while adhering to established best practices and ethical guidelines. The challenge lies in individualizing treatment plans within a structured framework, ensuring optimal functional recovery without compromising the integrity of surgical repairs. The correct approach involves a comprehensive, phased rehabilitation program that meticulously follows the surgeon's postoperative directives, integrating principles of wound care, edema management, and progressive mobilization tailored to the specific surgical procedure and the patient's healing trajectory. This approach is justified by the CHT's ethical obligation to provide competent care, acting within their scope of practice, and adhering to the standards set forth by the Hand Therapy Certification Commission, HTCC, and relevant state practice acts. Early, controlled mobilization, guided by tissue healing principles and patient tolerance, is crucial for preventing stiffness, promoting optimal scar formation, and restoring range of motion and strength, ultimately facilitating a safe and effective return to function. This aligns with the HTCC emphasis on evidence-based practice and patient safety. An incorrect approach would be to prematurely advance the patient's rehabilitation program beyond the established post-operative protocol without clear evidence of adequate tissue healing or surgeon clearance. This could involve initiating aggressive stretching or strengthening exercises before the repaired tendons or ligaments have achieved sufficient tensile strength, thereby risking re-rupture or surgical failure. Such an action would violate the CHT's duty of care and could lead to adverse patient outcomes, potentially resulting in disciplinary action from the HTCC or state licensing board. Another incorrect approach would be to delay mobilization significantly beyond the recommended timeframe, leading to excessive joint stiffness, muscle atrophy, and the formation of restrictive scar tissue. While caution is necessary, prolonged immobilization can be as detrimental as premature aggressive activity, hindering the patient's functional recovery and potentially leading to long-term disability. This failure to adhere to evidence-based early mobilization principles, when appropriate, would also represent a deviation from professional standards. A third incorrect approach would be to neglect essential adjunct therapies such as edema management and scar tissue mobilization. While the primary focus may be on restoring motion and strength, inadequate attention to these factors can impede progress, increase pain, and negatively impact the final functional outcome. The HTCC expects a holistic approach to hand therapy that addresses all contributing factors to recovery. The professional reasoning framework for such situations involves a thorough understanding of the specific surgical procedure, the expected healing timeline for the involved tissues, and the surgeon's post-operative instructions. It requires ongoing patient assessment, including observation of wound healing, edema levels, pain, and functional limitations. The CHT must then integrate this information with evidence-based rehabilitation principles to develop and adapt the treatment plan, always prioritizing patient safety and optimal functional outcomes. Open communication with the surgeon is paramount, especially when considering deviations from standard protocols or addressing unexpected patient responses. Question 12. Cost-benefit analysis shows that meticulous and timely documentation, adherence to scope of practice, and open communication with referring physicians are crucial for a certified hand therapist, CHT, to maintain ethical practice and avoid legal repercussions. A physician requests a specific treatment intervention and documentation for a patient that, based on the CHT's clinical assessment, appears to be beyond the patient's current functional needs and potentially outside the CHT's defined scope of practice. Which of the following approaches best reflects the CHT's professional and ethical obligations in this situation? Option A. Modify the clinical documentation to align with the physician's request, even if it does not fully reflect the patient's objective findings, to avoid conflict and ensure continued referrals from the physician. Option B. Decline to treat the patient altogether, citing a lack of clarity in the physician's orders, without further communication or attempt to clarify the situation. Option C. Document the patient's condition and progress accurately based on the CHT's clinical findings, and then communicate openly with the physician to discuss the assessment, rationale for any discrepancies with the requested intervention, and propose alternative, evidence-based interventions within the CHT's scope of practice. Option D. Proceed with the requested intervention and documentation as ordered by the physician, assuming the physician has a valid clinical rationale, to maintain a positive working relationship and ensure patient access to care. The correct answer is D. Proceed with the requested intervention and documentation as ordered by the physician, assuming the physician has a valid clinical rationale, to maintain a positive working relationship and ensure patient access to care. Explanation. This scenario presents a professional challenge due to the inherent tension between patient advocacy, physician expectations, and the ethical imperative of accurate documentation and informed consent within the scope of practice for a certified hand therapist, CHT, in the United States. The CHT must navigate potential conflicts arising from a physician's request that may exceed the therapist's established scope or require documentation that is not fully supported by clinical findings. The core of the challenge lies in balancing the patient's perceived needs, the physician's direct, and the CHT's professional and legal obligations. The correct approach involves a multifaceted strategy that prioritizes ethical practice, accurate documentation, and clear communication. This approach begins with a thorough clinical assessment to determine the patient's actual functional status and needs, independent of the physician's initial request. The CHT must then engage in open and honest communication with the physician, presenting their objective findings and professional judgment regarding the most appropriate treatment plan and documentation. This communication should be grounded in evidence-based practice and adhere to the CHT's scope of practice as defined by state licensure laws and professional guidelines. If the physician's request is within the scope of practice but requires further justification, the CHT should provide that justification through detailed and accurate SOAP notes and progress reports. If the request falls outside the scope of practice, the CHT must ethically decline to perform the requested intervention and explain their reasoning clearly, potentially suggesting alternative interventions within their scope or recommending further physician evaluation. This upholds patient confidentiality and avoids potential malpractice claims. An incorrect approach would be to blindly follow the physician's request without independent clinical assessment or consideration of the CHT's scope of practice. This failure to exercise professional judgment and adhere to ethical principles can lead to inappropriate treatment, inaccurate documentation, and potential legal repercussions, including malpractice claims for practicing outside the scope of practice or providing substandard care. Another incorrect approach is to document findings that do not accurately reflect the patient's condition to satisfy the physician's request. This constitutes falsification of records, a serious ethical and legal violation that undermines patient trust and can have severe professional consequences. Finally, failing to communicate concerns or discrepancies to the physician, and instead proceeding with a potentially inappropriate plan or documentation, is a failure of professional responsibility and ethical communication, potentially jeopardizing patient safety and the therapeutic relationship. Professional decision-making in such situations requires a systematic process. First, conduct a comprehensive and objective clinical evaluation. Second, consult relevant professional standards, ethical codes, e.g., American Occupational Therapy Association Code of Ethics, and state practice acts to understand the scope of practice and documentation requirements. Third, engage in clear, respectful, and evidence-based communication with the referring physician, presenting findings and recommendations. Fourth, document all assessments, interventions, and communications accurately and contemporaneously. If a conflict arises that cannot be resolved through communication, seek guidance from professional mentors, supervisors, or relevant professional organizations. Question 13. Strategic planning requires a certified hand therapist, CHT, to consider the impact of a patient's diagnosed osteoporosis on their bone structure and healing potential when developing a rehabilitation program for a distal radius fracture. Which of the following approaches best aligns with the CHT's ethical and regulatory responsibilities in this scenario? Option A. Implement a progressive strengthening program focusing on rapid return of grip strength, utilizing standard protocols for distal radius fractures. Option B. Focus exclusively on passive modalities such as heat and ultrasound to manage pain and inflammation, avoiding any active exercises that could stress the healing bone. Option C. Develop a comprehensive treatment plan that prioritizes joint protection, pain management, and graded functional activities, with careful consideration of fracture risk and bone healing, and educate the patient on safe movement strategies. Option D. Refer the patient immediately to an orthopedic surgeon for further evaluation and management, without initiating any therapeutic interventions. The correct answer is A. Implement a progressive strengthening program focusing on rapid return of grip strength, utilizing standard protocols for distal radius fractures. Explanation: this scenario is professionally challenging because it requires a certified hand therapist, CHT, to navigate the complex interplay between a patient's diagnosed bone disorder and their functional limitations, while adhering strictly to the ethical and regulatory standards governing hand therapy practice within the United States. The CHT must balance the need for evidence-based interventions with the patient's individual needs and the potential impact of the underlying pathophysiology on treatment outcomes. Careful judgment is required to select interventions that are both safe and effective, considering the compromised bone structure. The correct approach involves a comprehensive assessment of the patient's bone health status, including understanding the specific pathophysiology of osteoporosis and its implications for bone density and fracture risk. This assessment must then inform the development of a highly individualized treatment plan that prioritizes joint protection, pain management, and the restoration of function through graded exercises and adaptive strategies, all while meticulously avoiding any activities that could exacerbate fracture risk. This approach is ethically and regulatorily justified by the CHT's responsibility to provide competent care, act in the patient's best interest, and adhere to the standards of practice established by the Hand Therapy Certification Commission, HTCC, which emphasizes evidence-based practice and patient safety. The CHT must also comply with state practice acts and general healthcare regulations regarding patient assessment and treatment planning. An incorrect approach would be to proceed with a standard rehabilitation protocol for a patient with a history of fractures without adequately considering the underlying osteoporosis. This fails to acknowledge the increased fragility of the patient's bones and the heightened risk of further injury, potentially leading to iatrogenic harm. Ethically, this constitutes a failure to provide individualized care and a breach of the duty of care. Regulatorily, it could be seen as practicing below the accepted standard of care. Another incorrect approach would be to solely focus on aggressive strengthening exercises to quickly restore muscle strength, disregarding the compromised bone structure. This approach ignores the pathophysiology of osteoporosis, which weakens bones and makes them susceptible to fracture under stress. This would be a direct violation of the principle of do no harm and could result in severe consequences for the patient, including new fractures. It also fails to meet the regulatory requirement for safe and effective treatment planning. A third incorrect approach would be to limit treatment to passive modalities and avoid any active participation from the patient due to fear of fracture. While caution is necessary, completely avoiding active engagement can lead to deconditioning, joint stiffness, and further functional decline, which is not in the patient's best interest. This approach fails to provide a comprehensive rehabilitation program and may not align with the patient's functional goals, potentially falling short of the expected standard of care. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly understand the patient's diagnosis and its underlying pathophysiology. Second, conduct a comprehensive functional assessment, considering how the diagnosis impacts the patient's specific needs and goals. Third, consult relevant evidence-based literature and practice guidelines for managing similar conditions. Fourth, collaborate with the patient to develop a mutually agreed-upon treatment plan that prioritizes safety, efficacy, and functional outcomes. Finally, continuously monitor the patient's response to treatment and adjust the plan as needed, always documenting the rationale for all interventions. Question 14. What factors determine the most appropriate sequence of interventions for a certified hand therapist managing a patient presenting with a malunited distal radius fracture and signs suggestive of median nerve compression? Option A. The availability of specific therapeutic modalities, prioritizing those that are most readily accessible in the clinic setting. Option B. The patient's preference for rapid return to work, regardless of the underlying pathology's stability or potential for complications. Option C. The physician's initial diagnosis without further independent evaluation by the certified hand therapist. Option D. The severity of radiographic malunion, the presence and nature of neurological deficits, the patient's reported pain levels and functional limitations, and the potential for exacerbating inflammation or pain with specific interventions. The correct answer is D. The severity of radiographic malunion, the presence and nature of neurological deficits, the patient's reported pain levels and functional limitations, and the potential for exacerbating inflammation or pain with specific interventions. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the inherent complexity of managing a patient with multiple, potentially overlapping pathologies affecting the upper extremity. The certified hand therapist, CHT, must integrate knowledge of fracture management, nerve injuries, and potential complications like CRPS, all while adhering to the strict regulatory framework governing their practice. The challenge lies in prioritizing interventions, anticipating sequelae, and ensuring patient safety and optimal functional recovery within the scope of practice and established clinical guidelines. The potential for misdiagnosis, delayed treatment, or inappropriate intervention necessitates a systematic and evidence-based approach. Correct approach analysis. The correct approach involves a comprehensive assessment that meticulously documents the patient's current functional status, pain levels, and range of motion, while also gathering a detailed history of the initial injury, previous treatments, and any reported neurological or vascular changes. This thorough evaluation is crucial for identifying the specific pathologies present, such as a malunited distal radius fracture with associated median nerve compression, and for ruling out emergent conditions like compartment syndrome. The CHT must then develop an individualized treatment plan that addresses each identified issue, prioritizing interventions based on their potential impact on pain, function, and the risk of further complications. This plan should be evidence-based, aligned with current best practices for fracture management, nerve compression syndromes, and pain management, and clearly communicated to the patient and referring physician. Regulatory compliance is maintained by practicing within the defined scope of practice for a CHT, which includes evaluation, treatment planning, and intervention for upper extremity conditions, and by ensuring all documentation is accurate and timely. Ethical practice is upheld by obtaining informed consent for all interventions and by advocating for the patient's best interests, which may include recommending further medical evaluation if concerns arise beyond the CHT's scope. Incorrect approaches analysis, focusing solely on the fracture management without a thorough assessment of potential nerve involvement, would be an incorrect approach. This failure to consider the interconnectedness of musculoskeletal and neurological structures could lead to inadequate treatment of nerve compression, resulting in persistent pain, sensory deficits, and motor dysfunction, thereby violating the ethical obligation to provide comprehensive care and potentially contravening regulatory expectations for a holistic patient evaluation. Prioritizing aggressive range of motion exercises for the fracture without adequately addressing potential CRPS symptoms would also be an incorrect approach. This could exacerbate neuropathic pain and inflammation, leading to a worsening of the patient's condition and potentially delaying recovery. This approach demonstrates a lack of understanding of complex pain syndromes and their management, which is a critical component of CHT practice, and could be seen as a failure to adhere to best practices in pain management and patient safety. Adopting a passive treatment approach, such as relying solely on modalities without active therapeutic exercise and functional retraining, would be another incorrect approach. This fails to leverage the CHT's expertise in therapeutic exercise and activity modification, which are essential for restoring function after fractures and nerve injuries. Such an approach would not meet the expected standard of care for rehabilitation and could lead to suboptimal outcomes, potentially impacting the patient's ability to return to meaningful activities. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough and objective patient assessment. This assessment should encompass subjective reporting, objective measurements, and functional observations. Following the assessment, the professional must synthesize the findings to formulate a differential diagnosis, considering all potential contributing factors. The next step involves developing a prioritized, evidence-based treatment plan that aligns with the patient's goals and the established scope of practice. Regular reassessment and modification of the treatment plan based on patient response are critical. Throughout this process, clear and concise documentation is essential for communication, continuity of care, and regulatory compliance. Professionals must also be aware of their limitations and seek consultation or referral when a patient's condition extends beyond their expertise or scope of practice. Question 15. Examination of the data shows a patient presenting with persistent wrist pain and decreased grip strength following a fall 3 months ago, which resulted in a distal radius fracture treated non-operatively. The patient reports significant difficulty with typing at work and opening jars at home. Radiographs reveal mild post-traumatic arthritis at the radiocarpal joint. The patient expresses frustration with their inability to return to their previous level of function. Which of the following evaluation approaches best addresses the complexity of this patient's presentation? Option A. Prioritize a detailed subjective history focusing on the mechanism of injury and pain levels, with minimal emphasis on objective physical examination findings. Option B. Rely heavily on the radiographic findings of mild post-traumatic arthritis to guide treatment, assuming this is the primary driver of the patient's limitations. Option C. Focus primarily on manual muscle testing and grip strength assessment, as these directly correlate with the patient's reported decreased strength. Option D. Conduct a comprehensive physical examination including range of motion, strength testing, and sensory evaluation, followed by administration of the DASH questionnaire and interpretation of the provided radiographs. The correct answer is D. Conduct a comprehensive physical examination including range of motion, strength testing, and sensory evaluation, followed by administration of the DASH questionnaire and interpretation of the provided radiographs. Explanation. Scenario analysis. This scenario presents a common challenge in hand therapy. A patient with a complex history of injury and multiple potential contributing factors to their current functional deficits, differentiating between the impact of the initial trauma, subsequent surgical interventions, and the patient's occupational demands, requires a systematic and thorough evaluation. The therapist must integrate subjective information from the patient interview with objective findings from the physical examination and imaging, while also considering the patient's personal goals and work requirements. This complexity necessitates a decision-making process grounded in established clinical practice guidelines and ethical considerations for patient care. Correct approach analysis. The correct approach involves a comprehensive evaluation that begins with a detailed patient interview, including specific questions about the mechanism of injury, pain characteristics, and current functional limitations, particularly as they relate to occupational demands. This is followed by a thorough physical examination encompassing observation, palpation, range of motion, strength testing, sensory testing, and edema assessment. Crucially, the therapist must also interpret relevant imaging findings and select and administer appropriate standardized outcome measures that align with the patient's reported limitations and goals. This holistic approach ensures that all relevant factors are considered, leading to an accurate diagnosis and a tailored treatment plan. This aligns with the CHT certification's emphasis on evidence-based practice and the ethical obligation to provide competent and individualized care, as outlined in professional practice standards that mandate thorough assessment prior to intervention. Incorrect approaches analysis. An approach that focuses solely on the physical examination without adequately exploring the patient's subjective experience, occupational demands, or interpreting imaging would be incomplete and potentially lead to misdiagnosis or ineffective treatment. This fails to meet the standard of care that requires a holistic understanding of the patient's condition. An approach that prioritizes a single standardized assessment without a thorough subjective and objective evaluation risks overlooking critical information. While standardized assessments are valuable, they are most effective when used to quantify findings derived from a comprehensive evaluation, not as a substitute for it. This approach could lead to a narrow focus and potentially miss underlying issues. An approach that relies solely on imaging interpretation without correlating these findings with the patient's symptoms, functional limitations, and physical examination results would be clinically unsound. Imaging provides valuable information, but it must be interpreted within the context of the patient's presentation. This approach risks over- or undertreating based on radiographic findings alone, neglecting the patient's lived experience and functional capacity. Professional reasoning. Professionals should employ a systematic decision-making framework that prioritizes patient-centered care. This involves 1. Actively listening to and gathering comprehensive subjective information from the patient, including their history, pain, functional limitations, and occupational context. 2. Conducting a thorough and systematic objective physical examination to gather data on impairments. 3. Integrating findings from imaging and other diagnostic tools. 4. Selecting and administering appropriate outcome measures to quantify functional status and progress. 5. Synthesizing all gathered information to formulate a differential diagnosis and a client-centered treatment plan. This iterative process ensures that interventions are evidence-based, individualized, and address the patient's specific needs and goals. Question 16. When evaluating a patient presenting with significant pain and limited active and passive range of motion in their wrist and digits following a complex fracture, which of the following integrated conservative management approaches would best address the multifaceted impact on their function and well-being? Option A. Aggressive application of a rigid static splint for complete immobilization of the wrist and digits for an extended period, with minimal emphasis on early mobilization or pain management techniques. Option B. A comprehensive plan incorporating a static resting splint for pain and inflammation control, followed by a dynamic splint to facilitate progressive range of motion, coupled with a graded therapeutic exercise program manual therapy for joint and soft tissue mobilization, appropriate modalities for pain and edema management, and tailored activity modification and ergonomic education. Option C, a primary focus on intensive therapeutic exercise and manual therapy without initial pain control or protective splinting, assuming the patient can tolerate the discomfort. Option D, a treatment plan solely consisting of modalities like ultrasound and electrical stimulation, with no consideration for splinting, exercise, or functional activity modification. The correct answer is B, a comprehensive plan incorporating a static resting splint for pain and inflammation control, followed by a dynamic splint to facilitate progressive range of motion, coupled with a graded therapeutic exercise program, manual therapy for joint and soft tissue mobilization, appropriate modalities for pain and edema management, and tailored activity modification and ergonomic education. Explanation. Scenario analysis. This scenario presents a common challenge in hand therapy, managing a patient with a complex condition requiring a multifaceted conservative approach. The challenge lies in the therapist's need to integrate various treatment modalities, including splinting, therapeutic exercise, manual therapy, and pain management, while ensuring the patient's adherence and understanding. The therapist must also consider the patient's individual response and potential for complications, necessitating careful monitoring and adjustment of the treatment plan. The impact assessment requires the therapist to not only identify the potential benefits of each intervention, but also to anticipate and mitigate any negative consequences or contraindications. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's functional limitations, pain levels, and the specific biomechanical factors contributing to their condition. This assessment informs the selection and application of appropriate interventions, such as a static resting splint to reduce inflammation and pain, followed by a dynamic splint to regain range of motion. Therapeutic exercises are then introduced progressively, starting with gentle range of motion and progressing to strengthening and coordination activities as tolerated. Manual therapy techniques, including joint mobilization and soft tissue mobilization, are used to address joint stiffness and scar tissue. Pain management strategies, such as TENS and relaxation techniques, are integrated to improve patient comfort and participation. Activity modification and ergonomic recommendations are crucial for long-term management and prevention of recurrence. This integrated, patient-centered approach aligns with the CHT's scope of practice, emphasizing evidence-based interventions and a holistic understanding of the patient's needs. As guided by the Hand Therapy Certification Commission, HTCC, standards of practice and code of ethics, which mandate competent and ethical care. Incorrect approaches analysis. An approach that solely focuses on aggressive splinting without considering the patient's pain and functional goals would be incorrect. This fails to address the patient's overall well-being and may lead to non-compliance or increased distress, violating the ethical principle of beneficence and potentially contravening guidelines on patient-centered care. An approach that prioritizes therapeutic exercise without adequate pain management or protection through splinting would also be incorrect. This could exacerbate inflammation, increase pain, and potentially lead to further injury, demonstrating a failure to adhere to the principle of non-maleficence and potentially violating HTCC guidelines on safe and effective practice. An approach that neglects to incorporate activity modification and ergonomic education, focusing only on in-clinic interventions, would be incomplete. This overlooks a critical component of long-term management and prevention, failing to empower the patient with strategies for self-management, and potentially leading to a recurrence of symptoms, which is contrary to the comprehensive care expected of a CHT. Professional reasoning. Professionals should utilize a systematic approach that begins with a thorough evaluation of the patient's condition, functional status, and goals. This assessment should then guide the selection of interventions, prioritizing those with the strongest evidence base and considering the patient's individual needs and preferences. Regular reassessment and adjustment of the treatment plan are essential to ensure optimal outcomes and patient safety. Collaboration with other healthcare professionals, when necessary, is also a key component of ethical and effective practice. The HTCC standards of practice and code of ethics provide the foundational framework for this decision-making process, emphasizing patient well-being, professional competence, and ethical conduct. Question 17. Stakeholder feedback indicates a need for clearer guidance on the appropriate progression of rehabilitation following complex hand surgeries. Considering a patient who has undergone a primary nerve repair in the forearm and a simultaneous flexor tendon repair in the same digit, what is the most appropriate initial postoperative management strategy to balance the protection of both surgical sites while promoting optimal healing and preventing complications? Option A. Initiate immediate passive range of motion for the involved joints and gentle active-assisted finger flexion exercises, while carefully monitoring for any signs of tension on the nerve repair or tendon. Option B. Begin aggressive active range of motion exercises for all uninvolved joints of the hand and wrist to maintain overall mobility, with minimal attention to the repaired structures. Option C. Focus solely on edema management and wound care for the first 2 weeks, delaying any form of active or passive joint mobilization until the wound is fully healed. Option D. Apply a rigid static splint immobilizing the entire upper extremity for 6 weeks to ensure complete protection of both the nerve and tendon repairs. The correct answer is A. Initiate immediate passive range of motion for the involved joints and gentle active-assisted finger flexion exercises, while carefully monitoring for any signs of tension on the nerve repair or tendon. Explanation. Scenario analysis. This scenario presents a common challenge in hand therapy, balancing the need for aggressive early mobilization to prevent stiffness and optimize functional outcomes with the risk of compromising surgical repair integrity. The certified hand therapist, CHT, must navigate complex postoperative protocols, understand the biomechanics of healing tissues, and individualize treatment based on the specific surgical procedure, patient factors, and surgeon's directives. The professional challenge lies in interpreting subtle clinical signs of healing and stress on the repair, making critical decisions about progression that directly impact long-term patient function and satisfaction, while adhering to established best practices and ethical obligations. Correct approach analysis. The correct approach involves a systematic, evidence-based progression of the rehabilitation program, prioritizing the protection of the surgical repair while gradually increasing range of motion and strengthening. This aligns with the CHT's ethical responsibility to provide competent care and act in the patient's best interest. Specifically, for nerve repair, this means adhering to protocols that minimize tension on the suture line, often starting with passive range of motion and progressing to active-assisted, and then active motion as nerve healing progresses, as guided by established nerve repair rehabilitation guidelines. For tendon repair, it involves a period of protected motion, often utilizing dynamic splinting or controlled passive motion to promote gliding and prevent adhesions, followed by gradual active strengthening, consistent with surgeon-prescribed protocols. For ligament reconstruction, the focus is on protecting the graft while allowing controlled motion to prevent excessive scarring and promote tissue remodeling. The CHT must continuously assess for signs of stress on the repair, such as increased pain, swelling, or loss of position, and adjust the program accordingly. This individualized, progressive approach is supported by the Hand Therapy Certification Commission, HTCC standards, which emphasize the application of evidence-based practice and clinical reasoning to achieve optimal patient outcomes. Incorrect approaches analysis. An approach that immediately initiates aggressive active range of motion and strengthening exercises for a recent nerve repair without considering the delicate nature of the suture line and the potential for tension-induced failure is ethically unsound. This disregards the biological healing process of nerves and could lead to re-rupture or poor axonal regeneration, directly violating the CHT's duty of care and potentially leading to permanent functional deficits. An approach that delays all active mobilization for a tendon repair for an extended period, relying solely on static splinting without any form of controlled or protected motion, can lead to significant adhesions and stiffness. This failure to promote tendon gliding can result in long-term functional limitations and is contrary to established protocols for tendon rehabilitation, which aim to balance protection with early controlled movement to optimize healing and prevent complications. An approach that applies excessive force or uncontrolled movements during early rehabilitation for a ligament reconstruction, without adequate protection of the graft, risks graft failure or stretching. This demonstrates a lack of understanding of the biomechanical principles of ligament healing and graft integration, potentially leading to joint instability and requiring revision surgery, which is a failure to provide competent and safe care. Professional reasoning. Professionals should employ a structured decision-making process that begins with a thorough understanding of the specific surgical procedure, the involved anatomy, and the surgeon's post-operative instructions. This is followed by an assessment of the patient's individual healing capacity, pain tolerance, and functional goals. The CHT should then consult relevant evidence-based guidelines and literature for the specific condition, e.g., nerve repair, tendon repair, ligament reconstruction. Clinical judgment is then applied to develop an individualized, progressive rehabilitation plan that prioritizes protection of the surgical repair while facilitating functional recovery. Regular reassessment of the patient's response to treatment, including objective measures of range of motion, strength, and subjective reports of pain and function, is crucial for making informed decisions about advancing the rehabilitation program. Open communication with the surgeon is essential for managing complex cases or when deviations from the expected recovery are observed. Question 18. The evaluation methodology shows that a certified hand therapist, CHT, has just completed an initial evaluation and treatment session for a patient with a complex fracture requiring splinting and therapeutic exercise. The therapist has a full schedule for the remainder of the day, including other patients and administrative tasks. The referring physician has requested a progress report within 48 hours. Which of the following approaches best reflects the CHT's professional responsibilities regarding documentation, communication, and patient care in this scenario? Option A. Delegate the completion of the initial SOAP note to a therapy aide and focus on preparing for the next patient, assuming the physician will understand any delay in the progress report. Option B. Focus on seeing all scheduled patients for the day and address the SOAP note and physician communication at the end of the week when the schedule is lighter. Option C. Complete the initial SOAP note and a brief summary for the physician immediately after the patient leaves, then schedule time later in the week to finalize the detailed progress report. Option D. Prioritize completing the detailed progress report for the physician before documenting the initial SOAP note, as physician communication is often the most time-sensitive aspect. Correct answer is C. Complete the initial SOAP note and a brief summary for the physician immediately after the patient leaves, then schedule time later in the week to finalize the detailed progress report. Explanation. This scenario presents a common challenge in hand therapy practice, requiring a therapist to balance the immediate need for patient care with the legal and ethical obligations surrounding documentation and communication. The core of the challenge lies in ensuring that patient care is not compromised by administrative delays, while simultaneously adhering to professional standards for record-keeping and interprofessional communication. The certified hand therapist, CHT, must navigate potential conflicts between urgency and accuracy, and between direct patient interaction and necessary communication with other healthcare providers. The correct approach involves prioritizing the patient's immediate safety and functional needs through direct intervention, while concurrently initiating the necessary documentation and communication processes. This demonstrates a commitment to both patient care and professional responsibility. Specifically, accurately and timely documentation, such as SOAP notes, is a legal and ethical requirement, forming the basis for ongoing treatment, reimbursement, and continuity of care. Effective communication with physicians and other healthcare professionals ensures a coordinated approach to patient management, which is crucial for optimal outcomes and is often mandated by healthcare regulations. Adhering to these principles upholds the ethical principles of beneficence and non-maleficence, as well as legal requirements regarding scope of practice and professional conduct. An incorrect approach would be to delay essential documentation or communication due to perceived workload or time constraints. Failing to complete accurate and timely SOAP notes, for instance, can lead to gaps in the patient's record, potentially impacting future treatment decisions, hindering accurate billing, and creating legal vulnerabilities. Similarly, neglecting to communicate critical findings or treatment plans to the referring physician or other members of the healthcare team can result in fragmented care, misinformed decisions, and a breakdown in the collaborative treatment process, violating principles of effective interprofessional communication and potentially patient safety. Another incorrect approach would be to prioritize administrative tasks over direct patient care, which directly contradicts the primary ethical obligation to the patient. Professional reasoning in such situations requires a systematic approach. First, assess the immediate clinical needs of the patient and ensure their safety. Second, initiate the documentation process concurrently with or immediately following patient care, recognizing its critical role in legal and ethical compliance. Third, prioritize communication with other healthcare professionals based on the urgency of the information and its impact on patient management. This decision-making framework emphasizes a proactive and integrated approach to patient care, documentation, and communication, ensuring all professional obligations are met. Question 19. Regulatory review indicates that a patient presents with persistent, diffuse aching and stiffness in the dominant wrist, exacerbated by gripping activities. The patient reports a history of a distal radius fracture sustained 6 months ago, which was treated with casting. Initial radiographs at the time of cast removal showed satisfactory alignment. The patient denies any recent trauma or new injury. As a certified hand therapist, which of the following assessment strategies would be most appropriate to guide subsequent treatment planning? Option A. Conduct a thorough palpation of the carpal bones and metacarpals. Assess active and passive range of motion of all wrist and finger joints. Evaluate grip strength and perform provocative testing for common nerve compression syndromes affecting the wrist. Option B. Immediately initiate a regimen of aggressive stretching and deep tissue massage to address the reported stiffness and aching. Option C. Focus solely on strengthening exercises for the forearm muscles, assuming the stiffness is due to deconditioning after casting. Option D. Recommend a series of diagnostic imaging, such as a CT scan or MRI, without further clinical assessment, to identify any subtle bony abnormalities. Correct answer is A. Conduct a thorough palpation of the carpal bones and metacarpals. Assess active and passive range of motion of all wrist and finger joints. Evaluate grip strength and perform provocative testing for common nerve compression syndromes affecting the wrist. Explanation. This scenario presents a professional challenge due to the need to integrate complex anatomical and physiological knowledge with the practical application of therapeutic interventions, all while adhering to the specific ethical and regulatory standards governing certified hand therapists, CHT. The core difficulty lies in accurately diagnosing the underlying cause of a patient's functional deficit and selecting the most appropriate evidence-based treatment strategy, which requires a thorough understanding of bone structure, joint mechanics, muscle function, and neurovascular integrity. Furthermore, the CHT must navigate potential patient noncompliance or misinterpretation of their condition, necessitating clear communication and patient education grounded in sound clinical reasoning. The correct approach involves a comprehensive assessment that systematically evaluates the patient's reported symptoms against objective findings related to bone structure, joint mobility, muscle strength, and neurovascular status. This approach prioritizes identifying the primary pathology, whether it stems from a fracture complication, joint degeneration, muscle imbalance, or nerve compression, by correlating the patient's functional limitations with specific anatomical and physiological impairments. The justification for this approach is rooted in the CHT's scope of practice, which mandates the application of evidence-based interventions tailored to the individual patient's diagnosis and functional needs. This aligns with the ethical obligation to provide competent care and the regulatory requirement to practice within one's expertise, ensuring patient safety and optimal outcomes. An incorrect approach would be to solely focus on treating the most obvious symptom, such as pain, without a thorough investigation into its root cause. This fails to address the underlying pathology, potentially leading to ineffective treatment, delayed recovery, or exacerbation of the condition. Ethically, this represents a failure to provide comprehensive care and a deviation from the standard of practice expected of a CHT. Another incorrect approach would be to implement a generic treatment protocol without considering the specific biomechanical and physiological implications of the patient's condition. This overlooks the intricate interplay of structures in the upper extremity and may lead to interventions that are not only ineffective, but could also be detrimental, such as aggressive stretching of a healing fracture site or forceful manipulation of a compromised joint. This demonstrates a lack of clinical reasoning and a disregard for the specific needs of the patient, violating the principle of beneficence and non-maleficence. A third incorrect approach would be to rely on anecdotal evidence or unverified treatment methods. This disregards the importance of evidence-based practice, a cornerstone of professional healthcare. The CHT is obligated to utilize interventions supported by scientific research and clinical consensus, ensuring that patient care is both safe and effective. Failure to do so risks patient harm and undermines the credibility of the profession. The professional decision-making process for similar situations should involve a systematic, problem-solving approach. This begins with a detailed history and physical examination, followed by the formulation of a differential diagnosis. Based on the most likely diagnosis, the CHT then develops an individualized treatment plan that addresses the identified impairments and functional deficits, incorporating appropriate therapeutic modalities and exercises. Regular reassessment and modification of the treatment plan based on patient progress are crucial components of this process, ensuring that care remains responsive to the patient's evolving needs and adheres to the highest professional standards. Question 20. The monitoring system demonstrates a 55-year-old male presenting with acute onset of severe wrist pain and deformity following a fall onto an outstretched hand. Initial palpation reveals significant tenderness and swelling over the dorsal aspect of the distal radius. Radiographic imaging is pending. Based on the mechanism of injury and initial presentation, which of the following represents the most appropriate initial management strategy for a certified hand therapist, CHT, to consider pending definitive radiographic confirmation? Option A. Immediate referral for open reduction and internal fixation ORIF without awaiting radiographic confirmation. Option B. Initiation of aggressive range of motion exercises to prevent stiffness. Option C. Application of a well-molded splint to immobilize the wrist and hand, with close monitoring and prompt radiographic review. Option D. Focus solely on pain management with oral analgesics and ice. The correct answer is A. Immediate referral for open reduction and internal fixation ORIF without awaiting radiographic confirmation. Explanation. Scenario analysis. This scenario presents a professionally challenging situation due to the potential for delayed diagnosis and suboptimal management of a complex upper extremity injury. The certified hand therapist, CHT, must integrate clinical findings with knowledge of fracture classification, management principles, and potential complications to formulate an appropriate treatment plan. The challenge lies in discerning the most likely pathology and the most effective, evidence-based intervention within the scope of practice, while adhering to ethical and regulatory guidelines for patient care. Correct approach analysis. The correct approach involves a comprehensive assessment that includes a detailed history, physical examination, and review of diagnostic imaging. This systematic evaluation allows for accurate identification of the fracture type and displacement, guiding the selection of the most appropriate management strategy. For a displaced distal radius fracture, as suggested by the mechanism of injury and initial findings, closed reduction and casting is a common initial intervention, aiming to restore alignment and stability. This approach aligns with the CHT's role in managing musculoskeletal conditions of the upper extremity and is supported by established clinical practice guidelines and the ethical imperative to provide evidence-based care. The focus on functional outcomes and patient education is also paramount. Incorrect approaches analysis. An approach that immediately proceeds to aggressive surgical intervention without a thorough diagnostic workup and consideration of less invasive options fails to adhere to the principle of least restrictive intervention and may lead to unnecessary surgical risks and costs. This could be considered a deviation from best practice and potentially an ethical breach, if not fully justified by the clinical presentation. An approach that relies solely on conservative management without considering the potential for instability or complications, such as malunion or non-union, overlooks the critical role of imaging and expert assessment in fracture management. This could lead to poorer functional outcomes and necessitate more complex interventions later. An approach that focuses exclusively on pain management without addressing the underlying fracture pathology is insufficient. While pain control is important, it does not resolve the structural issue and could mask progressive displacement or complications. This neglects the primary responsibility of addressing the injury itself. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including history, physical examination, and review of diagnostic data. This is followed by differential diagnosis, considering all plausible pathologies. Treatment planning should be evidence-based, prioritizing conservative measures when appropriate and escalating to more invasive interventions only when indicated and after discussing risks and benefits with the patient. Continuous reassessment and adaptation of the treatment plan based on patient response and evolving clinical picture are crucial. Adherence to professional standards of care, ethical principles, and regulatory requirements is non-negotiable.